This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, I'm Michael Pham. I'm a PGY4, one of the chief residents at Wayne State University, DMC PM&R program. I think I have some other co-residents and our program director here as well, Dr. Ajloni, along with Dr. Shaw, Dr. Crawford, and Dr. Bratt, I believe. So we'll get underway. I'll try to make this presentation a little bit brief. That way there's plenty of time for questions at the end that we can all sort of address for you. All right, so this is just a picture of our facility. Wayne State University and the DMC campus is quite large. It has 3 very large hospitals. Top left, you can see that's our Rehab Institute of Michigan facing one of the roads. That's actually a big gym right there with all the glass that you see. We also have Detroit Receiving Hospital, which is a fully functional acute inpatient hospital, along with Harper. That's also an additional acute inpatient hospital. We also have a full-blown children's hospital on campus, along with the Karmanos Cancer Institute, as you can see there. So as far as our rehab hospital itself, it's the 69-bed inpatient unit. There is an outpatient clinic on the 1st floor. There's even a pain clinic on the 5th floor. We also have 2 fully functional interventional fluoro suites on the 2nd floor. All of that's in-house, along with a bunch of different gyms per specialty or per requirement. As far as the 6th floor goes, this is our neuro rehab unit. It's dedicated to TBIs, but we also have some stroke patients up here. All the rooms have video monitoring. All the staff there is really trained for that specific sort of thing. We also have a 0G unit that they could use for therapy as well. And this is some pictures of those rehab areas, those gyms. Then on the 4th floor, this is our general floor. We take care of a bunch of different patients, from debility to transplants, cancer rehab, amputees, burns, sort of anything you could really think of in that category. And as far as our 3rd floor, this is our dedicated spinal cord injury unit, fully comprehensive team. And this particular service actually gets its own gym, which is located on the 2nd floor. And that's right here. There's a full-blown track. We have a suspension system. We even have right there a ReWalk, one of those robots as well, that some of our patients utilize. In terms of our outpatient exposure and procedural exposure, again, we have that 1st floor outpatient clinic that's in-house. Now it's actually being used as part of our residency continuity clinic. But aside from that, there's a bunch of other outpatient facilities that you rotate through during your course of training. You're going to get experience in Botox injections, Baclofen pump management, refill, all sorts of joint injections. And you get a lot of the pain procedures too, if you're interested in that, a lot of axial procedures, image-guided procedures there. And these are some pictures. That's one of our newly renovated fluoro suites. There's a C-arm, and that's a couple of our residents, along with an attending performing a procedure. And this is our outpatient gym. It's quite large. There is a specialized cardiac rehab program there. There's also a fully functional, almost commercial gym size facility that we do have access to for free as residents. So that's really nice to be able to sort of, work out where you go to work, makes it really convenient. And there is a picture bottom right of some of those facilities. You have a lot of those, cardio equipment there. And we also have a car downstairs that patients actually learn to transfer in and out of, things like that. And this is our children's hospital. It's right across one of our sort of parks that traverse our campus. It's the Children's Hospital of Michigan. And you do get 2 months there during your training. It's a great staff. You do so many things there. You get to sort of, participate in rhizotomies, participate in all sorts of interventions there as well. There's 2 months of consult service. So you saw all those hospitals that we talked about before. You get to visit all of them, see patients with all different types of pathology. It's pretty, diversely comprehensive. And the cool thing is sometimes the patients that you see on consults, you end up taking care of on the inpatient side too. Really good continuity of care there. And then the newly added resident continuity clinic, that's Dr. Tyler Williamson. He sort of spearheaded this when he was a resident here at RIM, and it's great to see it come into fruition. Now that he's an attending, sort of helping us coordinate everything, and he's always there for support, but he gives us a lot of independence sort of to do what we want. It's one Thursday per month. You get to sort of, have this experience in the post-acute IPR management of your patients that you saw while they were in IPR. You get a full access to MAs to help you. You can schedule your own procedures, do all your medication management, and do things like, coordinate and prescribe orthotics and even prosthetics sometimes, working closely with some of those companies. This is as far as our sort of lounge area and our call room. It's all in one unit on the second floor. We have, couches, a big screen TV, a table that you can all eat at together. We'll have lockers. It's a halfway functioning kitchen, just no cooktop, but there's a bedroom in the back that you can hang out in as well. And we all sort of congregate here if you're in-house during your month. Just to add, we do have a meal card. It's like about $300. You get one every 6 months that you can use at our food court, which has, a Chick-fil-A, a really good Thai restaurant, sort of all those things that you want, Starbucks, Dunkin' Donuts. And we do get access to a free parking garage with a sky bridge. So, during those cold winter months, you don't have to sort of step, 1 foot outside at all just to get from one place to the other. There's a tunnel system as well within DMC. So you can stay completely indoors through those months as well, being up here, in the northern Midwest. As far as our other rotations, aside from our outpatient clinic at RIM, we have a full month or 2 months of EMGs over at the VA hospital, which is just right across the road. Again, you get a pan rotation with those attendings. You get sports, rheumatology, PT, OT, neuroradiology, neurology, orthopedics, which we just added on last year. And you get even more EMG experience during your 4th year, during your 2 months with one of our really good attendings, who's also teaching us anatomy, EMG, and those sorts of things. In terms of our didactics, we operate on a block system. It's every Wednesday from 8 a.m. to 12 p.m. We do get some food catered there now, and coffee as well if you're tired in the morning. And there is sort of a brief outline of all the things that we touch base on. Additionally, every October, there is an anatomy class with a full-blown cadaver lab that is sort of organized and taught by some previous attendings who graduated from RIM, Mrs. and Mr. Dr. Seidel. There's some of us doing sort of, I think that's a pro section, and there's also a class involved. And they are also the same 2 attendings that teach an EMG course in October as well. So they sort of alternate years there, and there are some of us getting some hands-on experience. So it's really good just to reinforce those 2 sort of topics. We also, starting about 2 years ago, one of our graduating residents, Dr. Andriano, put together an Msk Ultrasound course, which has incorporated its way into our didactics. We work closely with Sonosite that they come in, provide us with all the different machines we need to learn and to perform the demonstrations from. And here's some pictures of all of us doing fun things around, we love to have a social life outside of residency. We're all great friends, and we organize events all the time. We're in a sand volleyball league there. That's us out. So we like to have fun as well. And as far as Detroit, although the sports teams here aren't the greatest, we do have, all 3 within sort of, literally 10-minute walk of one another. There's Ford Field, Comerica Park, and Little Caesars Arena. So if you're a sports fan, maybe you can catch your own sports team playing one of our teams there. And that's it. So I left plenty of time for questions. Feel free to ask away. All right. And just to get it sort of moving, if one of our other co-residents on wants to give any sort of feedback or anything like that, or something to add to the presentation, feel free to chime in.
Looks like we have a question in the chat. The video going.
Yep. So now it's 4 per class. I believe my class was the last year with 5. So now we're taking 4 per.
So I think one of the kind of benefits of our.
Oh, I'm sorry. Go ahead, Barrett.
I was just going to say, I'm Barrett. I'm one of the PGY3s. One of the benefits of our program is, we do have kind of a dedicated spine program and a dedicated TBI neuro recovery program. So you get a lot of, when you're on those rotations, that's all you're doing. So that's a huge benefit that's, kind of unique to our program.
All right, we have another question. Do you accept international medical grads? Question from Dr. Ajlani.
Yeah, hey, Mike. Yeah, I don't know. I haven't been able to get my video to work. I don't know if anyone can see me.
Yes, we can see you.
Oh, you can? Okay, good.
Yeah, we can.
So, yeah, I'm Dr. Ajlani, the program director. At this time, we haven't been taking international grads. Things could change in the future, but, we've been kind of saturated with U.S. grads at the moment. And, just to comment on what my resident Barrett was referring to, being situated in an urban area with, frankly, lots of trauma, we get to benefit from that. So he mentioned the TBI and spinal cord, pathologies that we see, the burns, the traumatic amputations. We see a lot of things downtown on the inpatient ward and outpatient as well. That can be a pretty comprehensive and unique experience. So I think that's really beneficial to our residents' overall experiences.
And also I want to add in terms of fellowships, because I know a lot of us want to go on to do additional training. A lot of our residents match really well. Just the graduating class, we have someone going to Spalding at Harvard for spinal cord injury. 2 of them are doing interventional pain. One is staying in-house at DMC, another one's going to Henry Ford. We have one of our other residents going to Denver, Colorado for a pediatrics residency. So, we've been matching really well over the past few years. I think it's 100% match rate for anyone who's applied. Changes. All right. Yeah, there's another question for the residents. Can you give an example of any changes to the residency program that have been made recently as a result of residency feedback? Absolutely. So one of them is continuity clinic. That's very recently added just last year. We've always wanted it, just to give that, inpatient to outpatient experience, just especially even as an attending. You'll notice that a lot of the times that you're going to be juggling both, especially if you work for a large institution. Another one is the didactic schedule. It's been revamped over the past, I think, 3 or 4 years into this block schedule. Again, that ultrasound course was resident implemented. One of our residents wanted to get more involved in MSK and imaging and have that be a large component of his practice potentially one day. And he was able to fully incorporate it with a lot of support from all the faculty. So that's just 2 examples right there that I could think of at least.
Hey, Mike. So sorry, I'm Shelby. I'm one of the PGY4s as well, and one of the chief residents. It's kind of a smaller example, but we do take an overnight call. We do in-house call. And one of the concerns some of our residents had was when patients arrive, when new admissions arrive fairly late at night, how long should the day team stay to see their admissions, and then or when does the covering the call of resident take take that admission. So we've kind of recently implemented a 5 o'clock cutoff that if the patients aren't here within reason, we're not leaving like 4 or 5 patients for the on-call overnight resident to admit. But, if there's 1 or 2 that are coming in late, we're not making the daytime resident stay till 6 o'clock or 7 o'clock at night. We're letting the on-call resident do that. So that's been, I think, pretty well received. People like kind of knowing when they'll be getting off work, and there's some kinks in it that we're working out. Sometimes the on-call resident has a few too many than we'd like them to have, and so we're working on kind of putting some parameters on there. But that's kind of a smaller issue that we're working on, and our administration is always open to any ideas we have and giving it a try and seeing what works and what doesn't. So everybody's very receptive when we bring questions and issues forward.
5 minutes remaining.
Can I hop on really quick and say that I don't know if you guys can hear me or see me. I'm Anuj, by the way. I'm on call here tonight at RIM, and I'm a PGY 3. So for one of the changes that I saw that I came here last year for the first year is we implemented a research period where residents are able to explore research and pursue projects, and I think that was a newer change that was brought on about, and it really gave us the opportunity to sort of get our hands involved into projects and things that are going on in RIM and really pursue our passions. And that's something that's been great. I think overall this program does a really good job of implementing resident ideas. That's the root of the question. I think, that if you have something that is reasonable and you want to pursue and you want to explore, Dr. Zolny, the leadership team here, our chief residents, like everyone is so in touch and able to, really take a look at any of the requests that we have. And I think they do a phenomenal job here with that.
Yeah, just to piggyback on what Anuj is referring to, they make my job and the program coordinator's job really easy. Basically, the residents are idea machines, and they pass things along to us, and sometimes they're fantastic ideas and we implement them swiftly and easily, and other times they're not so great and they don't go anywhere. But that's all part of the process of improving. And I think even in the past 4 or 5 years, we've really evolved, and it's been mostly from the resident feedback that we get and the ideas that they'd like to see come to fruition. So that's a big part of our program, just kind of keeping your ears open and understanding that, there are concerns that they may have, and we should listen.
I think this was touched on. I don't know if anyone's about to say anything, but before. But the biggest thing I think that I would like to say is this program really, Dr. Zolny touched on it, on the different pathologies we see. We get so many different patients from all over, Michigan, and the pathologies we've seen are incredible. I think at the end of our residency here, not only are you really prepared for any job all over the US, because the acuity we see, the patients that we take, it's not just your bread and butter stuff. We're taking transplant patients, we're taking this traumatic spinal cord injuries, a large amount of them where, it's bread and butter for us. Nothing really is going to fool us. A lot less things will fool us in the future, I think. And we work really hard, but we also have, I feel a really good foundation that we can develop and grow on, whether that is for fellowship, whether that is for our future jobs. I think that it really gives us a solid foundation here. I just want to end on that.
One more thing I just wanted to bring up was kind of the culture that we have at RIM with the residents. That was one of the things that struck me from day one is how willing everyone is to help out and work together. And we're really a big family. And we take that to heart. I mean, if somebody's got a couple of admissions and you're sitting around, like, oh, I got my work done early. Like, I think the first 2 months I was on inpatient, I had somebody else jumping on that saying, hey, what can I do to help? How can I get you out of here and make sure you get out at a reasonable time? So I think that's something that the culture has really done wonders for the residency, is that we all just kind of work really, really well together. So.
All right. Thank you everyone for joining us. This is an absolute pleasure. Hope to hear from you all soon in the future.